As medical practitioners, many of us live in a constant state of unease at the thought of one of our patients taking legal action against us. So what can be done to minimise our risk of getting that dreaded legal letter? Whether you work in a hospital-based or private practice, our job is the healthcare of our patients. A major part of any medical practitioner's job is to communicate with each patient to ensure the best health outcome possible. For young doctors in particular, developing the right habits in all aspects of communication pre- and post-treatment can assist in minimising your risk. So what motivates patients to sue? In the Health Services Commissioner report in Victoria in 2006, the two largest areas of complaints received related to treatment and poor communication. However, comment is made in the discussion of treatment that, in most of these cases, there will not be any evidence of negligence. However, the patient often will believe this is the case if communication about risks has not been communicated sufficiently or understood. How can we minimise our risk and therefore reduce the likelihood of a date with the lawyers? Let's listen to MIPS medico-legal advisor and presenter Dr. Rob Walters as he provides details of some of the key risk management essentials and tips in minimising risks.
Take a full history and try not to interrupt. As a profession, we tend to interrupt rather early, and after about 15 to 20 seconds, we start interrupting the patient's history. They will continue and they're going to get their message across, and so it lengthens the consultation unnecessarily. You know, if you just let the patient run unimpeded, they rarely go longer than 60 to 90 seconds. You know, I always say there are three main reasons that a patient sues: communications, communications, and communications. It really is important to communicate carefully and clearly with your patient. Try to avoid using jargon, and if you must use technical terms, explain them and make sure that the patient understands. Also, be careful when you use humour. Whilst it can be warm and friendly, it may be that your humour does not coincide with that of the patient's, and so just be a little bit careful. The physical examination of a patient is a very important part of the consultation. Whilst you've got to be thorough, it's also important to explain to the patient what you're doing. If you have to undress them, explain to them why, and, if necessary, offer them a chaperone. Try to maintain modesty wherever you can. Investigations and which ones to do are often a bit of a dilemma. It's not a bad idea to explain to the patient what you're doing and why, and also to make appropriate plans for follow-up. It's probably reasonable that if a diagnosis passes across your mind as being a possibility, then do the investigations. When it comes to procedures, make sure that the patient understands exactly what you're going to do. It's important that they're properly consented and that they understand the risks and the benefits. Whilst it may sound obvious, before you start the procedure, actually say to the patient, "Now, are we ready to begin?" Medical notes are your best friend in court. It's a truism that if you've got no notes, you've got no defence. And so make sure that they're legible and reasonably comprehensive. Basically, good medical notes should enable someone else to take over the management of that patient seamlessly. If you do receive a complaint from a patient, it's very important that that complaint be handled professionally. Listen to the patient and be empathetic to their concerns. Explain to them your version of events. Often by handling a complaint professionally, litigation can actually be avoided. If a writ or legal letter does arrive, don't panic. Reacquaint yourself with the case and notify your medical defence organisation. Don't be tempted to change the notes. If you feel you want to make additional points, then put them in the margin and date them on the date you make those additions. In summary, to reduce your risk of litigation, there are a few points to remember. Firstly, remember first impressions count. Secondly, keep your practice contemporary and be warm with your patient. Take a comprehensive history, examine them thoroughly, and explain to them what investigations you're doing and why. Make sure they understand what you're thinking and make sure that you follow up. Above all, communicate, communicate, communicate.